far, there have been no confirmed cases of the Omicron variant here in India. But what's caused a lot of concern and worry is that 6 international travellers have tested positive for COVID, and their samples have been sent across for genome sequencing. In a few days from now, we'll know if any of them are carriers of the Omicron variant. These 6 international travellers were detected as COVID positive on day 1 of the guidelines for international travellers issued by the centre coming into effect. 3,476 passengers from 11 international flights, and these are from at-risk countries, were screened on Wednesday. 6 passengers were found COVID positive. Samples of all of the positive passengers have been sent for genome sequencing across 2 labs. Now, total of 11 international flights landed at various airports of the country from these at-risk nations. India continues to keep track of the evolving situation. The centre is supporting states and union territories in fighting the Omicron super mutant variant. And due to this growing threat, the Indian government has also rolled back plans of resuming scheduled international flight operations from 15th December. 5 days after they made the announcement, they've delayed the resumption of flight activity. Maharashtra, meanwhile, has decided to put a hold on mandatory RT-PCR tests. The initial order said that whether you're vaccinated or not, a domestic passenger also has to carry a negative RT-PCR test report. They've put a hold on that rule.
If one sees that the first report was from South Africa, the report was on the 9th of November. So during that time, many travels have happened all over the world and from and within South Africa. So one would not be surprised if this variant is detected within India. It's just a matter of time, of course. But it should not necessarily cause a panic, because majority of these infections might be asymptomatic or might cause mild diseases.
So as I mentioned, there was not a lot of clarity about Maharashtra's travel guidelines because it was different from the rest of the states, from what the centre issued. And that's why Maharashtra Health Minister Rajesh Tope, speaking to Rajdeep Sardesai yesterday, confirmed that they're doing a rethink on the current guidelines.
Why are you insisting on RT-PCR if I am double vaccinated and I want to come to Mumbai?
Yeah, absolutely. You are right. And we will be reviewing it. We had actually, after issuance of the order, we have deferred it at present, and we will be amending it as we will fall in line with whatever the other states are, or we will fall in line as per the government of India.
You're giving us a very big news point which we should flash. You're saying Maharashtra will defer the rules and you will fall in line with the rest of the country. Am I to understand, therefore, that for now at least you're keeping these guidelines on hold of RT-PCR and institutional quarantine?
No, not all, I mean to say, but the interstate actually is a hardship for everyone to do the RT-PCR test for every citizen flying from Delhi to Mumbai and from Mumbai to Bangalore. Right. So all these passengers will be facing a lot of hardships. So I think that is really a point which needs to be amended. Right. And so I had spoken to the Chief Secretary. Our Honorable CM is in the hospital at present, and so he has also spoken to the Honorable CM. And we are 100% amending that hardship clauses which has been mentioned in the orders issued.
So as I mentioned, the central government has right now put a hold on its earlier order, which announced the full resumption of international flight operations from December 15th. And this is at a time when finally we were seeing normalcy in international travel creeping in. Because of the Omicron variant, several steps have been taken also with regards to travel guidelines. There's a lot more screening, a lot more testing, a lot more surveillance at airports across the country. Now, all of these guidelines came into effect yesterday. And let's tell you exactly what the situation was at different airports in India.
The invisible enemy is back in a scarier avatar with over 30 mutations. Amid Omicron threat, centre and states are rushing to contain the mutant. In a mega move, the centre has put brakes on full resumption of international flights. Aviation watchdog DGCA, which fixed 15th of December as the date for restarting international flights, said it is watching the situation and a new date will be notified in due course. Maharashtra has made 7-day institutional quarantine mandatory for flyers from at-risk nations. Flyers will be tested 3 times on the 2nd, 4th and 7th day of their arrival. All positive passengers will be shifted to the hospital. Negative passengers will be further subjected to a 7-day home quarantine. Intra-state flyers need full vaccination or recent negative RT-PCR test. For interstate flyers, negative RT-PCR is must.
There are more than 40-50 booths that have been put up where RT-PCR tests are being done. Apart from that, there's a waiting lounge for people to wait in where, if the testing really takes a while, they'll be asked to wait. Also, for people who have connecting flights, if they are in transit, then for them also antigen tests have been put in place.
The Narendra Modi government, however, is upset with Maharashtra issuing guidelines that are different from those framed by the centre. It has urged the Maharashtra government to revise its guidelines. Checks imposed by other states are mostly in line with centre's guidelines. Delhi has made testing mandatory on arrival. If the report is negative, then the passenger will be subjected to a home quarantine for 7 days and get tested again. All positive flyers will be admitted to hospital.
There's a separate room in the airport which has been made where all the passengers coming will be asked to sit. The test will be done and they'll have to wait till the time the result does not come. Now, typically, the result takes anywhere between 5 to 6 hours, which means that your flight will take it longer. It will take you longer to come out of the airport.
The new norms spell hassle for flyers who are now made to wait for hours for test results and brave long queues at airports.
कोई गाइडेंस नहीं थी हमको कि आपको पीसीआर टेस्ट कराना है, और नहीं तो हम लोग पहले ऑनलाइन बुक करा के आते हैं। उसके बाद 2 टेस्ट हैं यहाँ पे, एक है नॉर्मल टेस्ट और एक है रैपिड फायर। नॉर्मल टेस्ट वो ले रहे हैं 8 घंटे, और जो रैपिड फायर है वो 1 घंटा बोल रहे हैं, बट 1 घंटे में किसी को रिपोर्ट दी नहीं। तो अंदर काफ़ी लोग परेशान हो रहे हैं कि बच्चों के साथ छोटे बच्चे वेट नहीं कर पा रहे, उनका खाने को कुछ नहीं है।
The WHO, meanwhile, opposed blanket travel ban, calling them ineffective to curb the virus threat. With Vidya and Aishwarya Paliwal, Bureau Report, India Today.
So with the Omicron variant spreading across the world, is it time for India also to start booster doses to ensure that citizens again have antibodies? Now, this is a debate that's been reignited in light of what's happening right now. And a chorus within the country is growing for the booster dose. Serum Institute of India, meanwhile, has sought approval for a booster dose for its Covishield vaccine from the Drug Controller General of India. Serum Institute has cited UK's regulatory booster approval for AstraZeneca and has claimed that it has enough vaccine stock in the country. The COVID-19 task force member N.K. Arora has said that India will have a policy on booster doses in the next 2 weeks. 36 nations across the world are currently administering booster COVID doses to their population. The United States, leading, has administered 1.24 crore booster doses so far, followed by Turkey, which has administered 1.19 crore booster doses.
If somebody has not been able to mount enough immunity after the 2 doses, for that individual or for a special subgroup, one could think of, administering a 3rd dose. But the discussion around that should be disjointed from the Omicron, because we do not know yet whether the presence of Omicron would require a vaccine, because we must remember that these vaccines against COVID-19, they are disease-modifying vaccines. They are not infection-preventing vaccines.
We know that the virus has infected people who have received 2 doses of vaccine. We even know from the Israeli case that there is a person who had received a booster dose of a Pfizer vaccine, therefore 3 doses of vaccine, and still got infected. So we need much more clinical information on the severity of illness, much more clinical information on when it infects a vaccinated person, what it does, how severe is the breakthrough infection, before we decide what else is needed.
Our reading as of now is that the boosters, given the situation of the vaccination program that we have today with our vaccines, is really not required at this point in time. We'll continue to explore the timing and the need for the boosters going along. There are studies that are in the offing. There are studies that are ongoing, in fact, and there is data that's very systematically being tracked.